Hello again, everyone. Thank you for joining. My name is Sheikha Salum Mohamed. I'm an African Regional Mesh Coordinator based at Ifakara Health Institute in Tanzania. And I will do the housekeeping first, and then I will welcome our speakers to introduce themselves before we go ahead. This webinar is being recorded and will be shared in the Global Health Network platforms. To automatically translate the speech to subtitles in your chosen language, kindly check the closed caption function and select your language. And due to the number of participants, your video and microphone have been disabled. Please use the chat function to introduce yourself or to report any technical issues. And please use the question and answer function to post your questions and comments. You may do so anonymously. Before welcoming our presenters or our speakers, I would say, I would like you to take a moment and respond to our poll questions. This is like a startup quiz. So for the first questions, it's a choice. You could just click on the right answer that you think fits the question, and that will be it. And for the second questions, you'll be directed. Wow, thank you so much for doing the questions. I welcome you again for the webinar. I will be chairing the sessions, and now I would like to welcome our panelists, our speakers, to take a round of introduction, starting with Professor Fredros Okumu. Welcome, Fredros.
Hey, good morning, Sheikha. My name is Fredros. Good morning, everybody. I work at Ifakara Health Institute, actually, and I'm a mosquito biologist, but I also have a faculty position at the University of Glasgow. So it's nice to be here, and I'm looking forward to the conversation. Thank you.
Thank you, Fredros. Over to Naima.
Hello, everyone. Good afternoon. My name is Naima Sykes, and I am the head of global stakeholder engagement at Target Malaria, which is based at Imperial College London, as well as numerous other countries in Africa. And I'm very much looking forward to discussing what I consider a very important topic. And it's an honor to be here with you all today.
Thank you so much, Naima. Noni, over to you.
Thank you, Sheikha. Hi, everyone. Noni Mumba is my name, working in Kenya, in a county called Kilifi. I work for a research program known as KEMRI Wellcome Trust Research Program, based in the Kenyan coast. I have worked here for the last, this is my 11th year, and I've worked as a head of engagement, main responsibilities supporting our scientists to develop and implement appropriate engagement approaches to engage on the science that we do. Thank you.
Thank you so much, Noni. Now to the last but not least, it's just the alphabetical matters. Prosper.
Hi, my name is Prosper Chaki, a senior medical entomologist with the Ifakara Health Institute, with keen interest on community-based surveillance and control of vector-borne diseases in Tanzania and across Africa. So happy to be here to share the experience.
Thank you so much, Prosper. So let us start our journey to speak about community engagement and how this meaningful partnership between researchers and public and communities could lead to positive and impactful research results and outcomes. So by starting, I will welcome the panelists. I will give 5 minutes each to each panelist so that they could give like an opening remark before we draw into the guided panel questions. Fredros, you're on the spot because of your name. It's starting with an F, but well, being a lady, I would just jump through you and go to Naima. Welcome, Naima.
Sorry, Fredros. Thank you again for welcoming me today. And just to begin the conversation, I'll start off by introducing a little bit about the project that I'm working on. So I work for Target Malaria, which is a not-for-profit international research consortium that aims to develop and share novel genetic technologies for malaria control. In essence, we want to help, and I say help because there are numerous other researchers, developers, etc., who are working towards the same goal of a malaria-free Africa, as well as a malaria-free world. And we want to help to save as many lives as possible. Every year, malaria kills over 500,000 people and infects over 200 million people. A third of the world is at risk of contracting this disease, and this disease is transmitted by mosquitoes. The majority of the victims, unfortunately, are children under the age of 5 living in Africa. So as a Tanzanian, that's why this is something that's very important to me. And at Target Malaria, we believe that hopefully we can work together to find potential solutions to prevent this disease so that it stops destroying so many lives and families and economies and countries and regions. And my colleagues in the lab are researching genetic technologies to find new approaches to controlling malaria by focusing on potentially reducing the number of mosquitoes that transmit the malaria parasite. And we are very grateful for the existing interventions that are still very important and are saving so many lives. So everyone, sleep under mosquito nets when you need to, take your anti-malarials when you need to. But unfortunately, the studies show that the existing tools, while they have helped to lower the burden, we're still struggling to eradicate the disease, and issues such as climate change coming into the forefront are potentially expediting the disease. So that is sort of the why I'm here and what we're working on. At Target Malaria, we have 3 pillars. So 3 key teams that are working together. And the first is, of course, as I mentioned, the science team. These are my colleagues in the lab who understand this technology at a much deeper level than I ever will. But thankfully, I have key scientists also on the panel here. So if you ever have any technical issues, I will be looking at Prosper and Fredros, please, to answer them. The second pillar is our regulatory affairs pillar. And this is also critically important because the work we do is very heavily regulated. And I think this is something that sometimes people can forget. And they think that these are experiments taking place with no oversight, and that's not the case. At the global level, this research is overseen by the UN Convention on Biological Diversity. At the national level, there are various regulatory bodies and national biosafety institutes that oversee our work, but also at each institution, there are institutional ethics committees that make sure that everything we do is in line with the ethical principles that have been set out. And last but not least is our third pillar of stakeholder engagement, and that is the one that I oversee and manage. In stakeholder engagement, and that's going to be the main topic of today, I'll be highlighting our community engagement work, as well as the important work conducted by my in-country colleagues based in Uganda, Burkina Faso, and Ghana. And with that, I'll stop and pass it on to whoever you see fit, Sheikha.
Okay, I'll just follow the lead on my screen. I'm now jumping to Prosper.
So I think the topic itself is very interesting. And on the back end, we had this very interesting discussion early on. I wouldn't want to start by introducing what I'm working on, because I've worked on a number of programs. Most of them, they have had the community engagement aspect. And this is what has led, has driven my interest in terms of what the community engagement really is. I think earlier on we had a little bit of a discussion on what is a community and what is the difference between a community and stakeholders. Naima has talked about stakeholder engagement and the publics. So just to settle on the community aspect, I think one thing that I would want to share here is we need, first of all, to recognize that communities do set up they define the context in which where we work, where we live, and the historical, like the tradition has been to define communities by where people live, the geographical location, which in most cases, I would say it does not hold water. Specifically when it comes to the kind of work that we've been doing at the research, as a research institution. So I've worked on, I would cite 2 examples of programs that I've worked in my career so far. One is on larval source management, rationalization of larval source management for controlling malaria vectors, where it's a community. The vectors are affecting the communities, and you expect that the communities always find it useful to embark on the work that you actually do. But the one thing that we had to do is, one is you need to define who is your community that you're working with. And you need to have a micro and macro, meso and micro levels, definitions of the actual communities. And I will cite examples. When you deploy, let's say, bed nets, there will be sections targeting pregnant women and infants. These are the most affected, we say, the most prone section of the community. And then you go to school children, and in some countries like Tanzania now, they have even school net programs where they distribute bed nets through these school channels. But then there's other sections of the communities which they are not necessarily responding to any of the strategies. Let's say fishermen, for instance, or the guards. So these are, again, constituting their own part of the communities, which are an essential part of the total that you need to find better ways of engaging. So why community engagement? One for me would be, one is to make sure that the research agenda or the research that we do is locally tailored to the community's needs. That is number one, interest. Second, we need to make sure that we deliver, we improve on the delivery of whatever interventions, whatever strategies that we put in place, be it gene drive, be it bednet, be it LSM, be it IRS. You need to still be part and parcel of the communities. One is to, as I said, asking yourself, does it respond to the question that the communities have, the concerns that the communities have? And number 2 is, how do you improve, reach out, how do you reach out sections of the community, the hard to reach sections of the communities, like the fishermen or the mobile traders, et cetera, et cetera, et cetera. So I think is it important? I would say it's critically important. What is the use? I would say, I think that is dependent on the topic, on the agenda that one is pushing. It can be for delivery. It can be to kind of nest it within the community needs, and that to make sure that you are more effective at delivering whatever intervention that you have. I'll stop here. Over.
Thank you so much, Prosper. That was very insightful, and it's just getting this discussion really started. Noni?
Thank you very much, Sheikha, and hi, everyone. So I think I'm going to do a thing, as a lot of things are already being talked about. I think I'll talk about basically the different types of research and how community engagement needs to really take into consideration the type of research. If I hope we'll tackle it, but if we are not going to tackle it in our talk today, where I work here in Kilifi, we carry out it's a large multinational research program, a partnership between a local government research institute known as Kenya Medical Research Institute here in Kenya, but we have a partnership with the University of Oxford and the Wellcome Trust. And so we've been in existence for the last over 30 years now, and we carry out all kinds of research, starting from basic research, happening in the labs. We have different kinds of clinical research work, including clinical trials where we, test drugs, we test vaccines. We have, long-term, very, very long-term surveillance studies, some which we just recently closed and have been going on for over 10 years, collecting data. We have research that is looking at health systems, looking at nursing care, medical care in hospitals, looking at financing systems between, the Ministry of Health and Treasury, government treasury, looking at supply of drugs to facilities. So we carry out a variety of research projects. Again, also our research here takes place in hospitals, large hospitals, small primary healthcare facilities, what in Kenya we call health centers or dispensaries. We also have research that happens within the community at household level, with research staff visiting community members at their homes, either to administer informed consent and recruit or even to collect samples. And so it's very critical that when you're beginning to think about community engagement, stakeholder engagement, or whichever group you have identified to engage, it's really important to understand that one approach of engagement may not necessarily work for a type of research or a type of a group. So from our experience, what we have learned is for every research protocol that is written that involves human subjects, we have to set up a committee with the principal investigator and the research team and us as the engagement team and discuss for that research project specifically, what engagement will you do? What approach are you going to use? What is your goal? What's your objective of engaging for that project? So it's not very easy work, but it's very exciting. It's very fulfilling. Researchers learn a lot from just engaging with the community members, and community members themselves learn a lot in terms of building also their knowledge in terms of science. So I'll stop there. I hope I don't take too much time. Back to you, Sheikha.
Thank you so much, Noni. Now we have Professor Fredros Okumu. Welcome.
Yes, this is incredible listening to Naima, Prosper, and Noni. Thank you all so much, and thanks, Chef, for the invitation as well. My name is Fredros, as I said earlier. I also I work at the University of Glasgow in Scotland, and also the Ifakara Health Institute, where I work as a mosquito biologist there. And yeah, so sorry, I was distracted by the chat, but that's fine. So the conversation today is about stakeholder engagement. I think it's best probably to preface this by just saying that essentially what we mean here is collaborating with the people, collaborating with the communities. And we do this for primarily three reasons. I mean, it would be nice to hear what Naima and Noni and Prosper have to say about this, but I see it as, collaborating with the people for three reasons. Number one, we want to figure out what is the existing knowledge in these communities about the subject that we are talking about here. And can we use that knowledge either as a baseline or to augment the stuff that we have? If you're doing this very early on in the projects, you also probably want to use that knowledge to formulate whatever research it is that you're doing. So broadly speaking, we do this, number one, to understand the existing level of knowledge in the communities. The second reason we do this is primarily to gain trust. And I think some people call this, the social license to operate. This is a much more long-term process. It usually depends not just on that specific project, but it's also really an institutional thing. Have you built trust within these communities and as an institution? My friend Noni works at KEMRI, and you could have a single project come in today, you go into the community, they say, oh, but your people came here and they never came back. So this becomes legacy from a previous project. So some of these community engagement collaborative processes have to be built in at institutional level rather than at project level, because you want to build trust, and that's an important thing. That's a second reason that we do these collaborations. The third, which I think is also very important, is to identify key priorities. And scientists, obviously, we have our own interests. I might be interested in the breeding behavior of mosquitoes, or the cell division in certain organisms. And I think that's important, and I might see a link as to how this might be useful for a community, for certain communities. But these communities also do have their own priorities, and I think it's important that as much as we want to do some form of either blue sky research or something that we think might be useful for a broader group of people in future, it's important for us to also figure out what are the current priorities of these communities and build this in a little bit in the kind of research that we do. So how do we do this? Obviously, it's not like we're going to ask people, say, what do you need? And then you do research only on that. We understand that sometimes you want to do research on things that people do not need. And in fact, there is very good, a lot you can say about the fact that people don't always know what they need. So I've had people say that people who built iPhones didn't really ask people, what did you need? They just built something excellent, and people loved it. So that there's a little bit of give and take here and there, but it's still very important to figure out what are the priorities of these communities. A friend of mine told me that, I had a $20 million grant to go and study these tiny molecules in District X. And I arrived at the district, oh man, 80% of deaths are happening at home. Kids are so sick of like 7 different diseases. So what about my molecule with $20 million? Perhaps I could just build a hospital and go home and be happy. And obviously, if you ask this community, they say, build us a water tank, build us a hospital, build us a school. If you have $20 million, this could do a lot in a district, in my rural district. But and from a research perspective, this buys, a few PCR machines here and there, and it's all done. So integrating this community needs into your research is probably a good idea. So I just want to end there for now, and then we can continue the conversation. Thank you so much, Sharon.
Thank you so much, Fredros. So now I will be throwing some questions to our panelists. And then when we finish the question that we will have an open Q&A questions where you can write your questions and we will have the panelists respond to them. Well, starting this discussion, or I would say the question is, I would ask Noni, what does community engagement in public health research or in global health research really mean, or what does it entail? And if there is a consensus between the, the researchers or the experts on what it means to do the community engagement, like how could you explain that?
Thank you. I thought you were going to start with somebody else so that so that I build my response from what somebody else has said. Okay, so of course there are textbook textbook definitions of what community engagement and involvement is. I like to call it community engagement and involvement in global health research. I use that longer name so that it's very specific that what we are talking about is engagement in research. And simply put, this is a process by which researchers, scientists can come together with non-scientists, people who are lay populations, and have meaningful interactions and conversations that then are aimed at impacting positively the research work that is being done, with an end result of eventually benefiting the population or the people in the area where the research is being implemented, be it in a local area in a country or even a region across several countries. So that is sort of like a very simplified definition of what is, if somebody was to ask what is community engagement. As has already been said in the opening remarks by my colleagues, it involves a variety of audiences. I come from a communication background, by the way. I'm a communication expert, gradually moved into community engagement or engagement in general. Again, the definitions also vary in terms of the audience that you want to engage, the audience and the goal of why it is that you want to engage. When you ask about is there a consensus in terms of the understanding? From my experience, not really, especially and that's why I said I like to say community engagement and involvement for global health research, because it's not a very old phenomenon in terms of community engagement in research. There has been some element of engaging by scientists. If I give an example of where I work in Kilifi, I joined about 10 years ago, and we are about 2 decades. I've said we've been working here for over 30 years, but we are in terms of engaging, we've done that for around 2 decades. And so there's differences in terms of what researchers think and feel about the definition or even the goal of engagement. For some scientists, it's, I engage so that I can be able to just directly get research participants into my study, beginning and end, nothing further than that. For some of us who may be in the social science spectrum, it's more of developing a relationship. Engagement is developing relationships. Engagement is pulling in people to be able to sit at a table and have conversations with them at par, on the same table, without you having hierarchies, sharing power with the population that you want to engage. So I think for me, that's what I would say is community engagement and involvement. Sheikha, back to you.
Thank you so much, Noni. I did, my thesis was on community engagement, and it was really, it was a tough challenge to me because most of the papers or most of the peer-reviewed articles didn't have a consensus on that, as you explained. So this is also an eye-opening. Thank you again, Noni.
Just to add that gradually we are moving towards having actually a consensus of what is community engagement and involvement. I think in the past, as I've said, it's a new phenomenon. In the past, people are still trying to understand what are we saying, what are we talking about, but by and large now, people are beginning to understand and moving towards sort of like some set definitions that are agreeable across board.
Yes, and I would agree to that, because if I would have done my search terms last year, and if I did the same now, I would have better results now. So I would really agree to that. Over to Prosper.
Well, I think Noni has set up a very broad definition of what community engagement and involvement. I like the last the way she's coined it. Community, not just community engagement, but community engagement and involvement. As I said in my introductory statements, I think for me, community engagement, one is driven by the objective and the audience. How do you define what is your objective? What is it that you want to achieve? Is it for service delivery? Is it for improving care? And that is sort of shaping the entire subject. So I said earlier on that also communities, they're considered sort of a game changer or the lever of any changes that one anticipates to take place within communities. That is one. So as the context determinants, they also provide a mechanism on which research projects or programs will be operating. Because if the need is to service the communities, if the need is to make sure that whatever interventions that we design or we deploy to in areas with challenges, they are locally tailored. That means you really need to understand on how the communities interact with one another. I think earlier on we talked about the different amenity or sections within a community and what can actually seem to be a community engagement. At times you have very good intentions of introducing a community engagement or establishing a community fully participation into a project, but then it really becomes a challenge because it's not really engagement or it's not involvement, it's hiring. And this is again driven by the context. So for instance, you are working in urban settings where you do have a lot of macro and micro environments within very short distances. Let's say it's very difficult to assign where you have very well-developed areas, where fenced houses and a neighborhood with normal squatters. Your approaches to community engagement will definitely be driven by your intentions for designing community engagement. There will be a neighborhood where you definitely deploy other approaches, different approaches, as opposed to the approaches that you deploy to other areas. So I think for me, community engagement, one is to make sure that we integrate, or Fredros used, we collaborate with the communities in shaping the research agenda, in making sure that we harness their thinking, their concerns into number two reason why we would have community engagement, because we want to empower communities to take actions for their own challenges. So I think for me, those will be key areas. Like one is make sure that we address the concerns by tailoring the research that we have to the communities. But second is make sure that we do have mechanisms to empower communities to take actions on shaping the management of the challenges that they are facing within those communities. Over.
Thank you so much, Prosper. Naima, your turn, please.
Sure, I'm trying to pick my points that haven't been said already so that I don't repeat. But I think, and maybe I can also start by a bit of an insight into my own career. And this is to say that while I have been in the public health research field for the last 4 years, the 10 years before that have been in stakeholder engagement and strategic communications in other fields. And I think one thing that I would like to begin with is just the point that stakeholder engagement, the importance of community engagement is nothing new. And it's not unique to public health or research. And one of the definitions that I go back to, which might seem out of context, but I think is still so relevant, is the definition provided by the International Finance Corporation from the World Bank, which provides a handbook for companies to follow in terms of how to ethically conduct business in emerging markets. And this definition really resonates with so much of what my fellow panelists have already said today, which is that stakeholder engagement is about building and maintaining constructive and meaningful relationships over time. It is an ongoing process between the organization or the institution or the company and its project stakeholders that extends throughout the life cycle of the project and encompasses a range of activities and approaches depending on the context, depending on who you are, what you're trying to achieve, depending on where you are, depending on when it is you're operating. We don't exist in a vacuum. We're constantly being molded and shaped by external forces, but also internal changes within our field of research. And it really comes down to participation, negotiation, compromise sometimes, but fundamentally building partnerships. And I think I'm resonating with the quiz that you started the webinar with, but it is about getting in early. And I think I saw a question that said, what about the engagement activities that take place to really understand the community before you come in with your own preconceived notions. And at Target Malaria, I can say we're very blessed because a lot of the teams that operate and engage with the communities tend to be from those communities, or at least from the peripheries of those communities. So there's already that understanding. But as a research institution and associated with our value of excellence, we're also very grateful to have social scientists on board who can support the ethnographic studies that do inform how we go into these communities, when we go in, which language we use. And I'll talk about my glossary example later in a different question. But that is fundamental, I think, also in the respect building and respect maintenance. This is to say that your own preconceived notions on how communities should function are not invalid, but they shouldn't lead when you're going into a community and you're not yet sure how they do things, what their priorities are. I think it's also important to have a long-term view and establish and maintain these good relationships in order to truly foster that local appreciation and local trust. That does not come in one day, and that it cannot simply be tick boxing. Is that the word? Tick boxing. Yes, activity. And also you need to make sure that you have the capacity and the skill set to curate your stakeholder engagement and community engagement strategies to the context. There is no one size fits all approach. And I can say this even if talking about the in-country teams within Target Malaria. What could work in Burkina Faso may not work in Uganda. What may work on a mainland field entomology site may not work on an island site. And so these are some of the pieces that I think is really important, that as researchers, as individuals interested in community engagement, we need to be open-minded, I think, to being informed, but then also having your mind changed and having your strategy amended based on international, global recommendations that could come out from, let's say, the World Health Organization, that could come out from the National Academies of Science, Engineering, and Medicines, recommendations that could come from the African Union, but also, I think, to the communities. And I think that's where, if I go back to what is the role of community engagement in our work, it's really to ethically prioritize the communities in which we operate in. And at Target Malaria, we, as I mentioned earlier, we have to follow the legislated mandated requirements from the national regulatory bodies. But as a project, we have also made the decision to prioritize the perspectives of the community. So this is to say, we only operate in field sites where the community has welcomed us. And if and when a community says, thank you, but no thank you, of course, we have to work together to understand, under which conditions would they be open to the research. But there has to be, I think, a recognition and an openness to what if they say no. And I'll stop there.
Thank you so much, Naima. Thank you. Fredros.
Yes, sure.
So,
What's the question?
Yes, my question, if you remember it. What does the community engagement in global health research entail? And
Yeah.
do you think there is consensus?
I don't think we need a consensus. Not at all. In fact, I think it would be a mistake to try and get a consensus. The reason I say this is that communities by nature are very different. And the reason we have to do these engagement processes is essentially because of these differences in communities. And therefore, whatever definition you have, as long as you mean collaborating with the people to understand their problems, build trust, get their priorities, and get the local knowledge, whatever definition you want to use for that, whatever terminology you want to use for that, you're good to go. So I actually do not think that we need a consensus. Obviously, in the academic cycles, someone might say, hey, define community engagement. And that's a very academic exercise, and I respect that. In practice, I'm not sure it's really necessary. I mean, this is basic English word. If I say community engagement, everybody knows what I mean. Now, in practice, how do I do it? And that depends really on those communities.
So, Fredros.
Yeah.
True that we might not need a consensus, as communities are very different in background or in socially or culturally. So as Naima said, what fits prospect A might not fit prospect B. So in your line of work, when you see there is a need of doing a community engagement, what are your ultimate goal?
Yeah, so like I said in the beginning, there's always a need to do community engagement. You have to be careful that you're not doing too much of it or too little of it. I see nowadays everybody says, are you working with NMCP? Are you working with the villages? I'm like, oh man, I'm just doing some basic science in my lab here. Why do you tell me to go? Doesn't always have to be community engagement. So, because you see now it's also fashionable that some scientists went somewhere, they took a picture, and now this becomes the deliverable. I don't think that's really helpful. You've got to genuinely collaborate with these communities from as early as possible and as late as possible. But got to be careful here. So if I have a result, if I do my research somewhere and I discover that medicine X was better than medicine Y, I don't think it's my role to tell communities to go to medicine X. I have to be careful here that this is still channeled directly to the regulatory agencies to evaluate this, to look at this data critically, and it's up to them to then inform. So there are things that scientists or researchers must avoid, even if they want to collaborate. So things like releasing results to the communities, for example, I find ethically that's a little bit an area we need to be restrictive on here. Because we should not necessarily interpret our findings to be the ultimate outcome. It's got to be evaluated together with many others. So there's some give and take, there's balances here, and I think scientists have to be very careful how much engagement we do and what nature that engagement takes. And it's a balance, and it's a very difficult thing to do. Yeah.
And if I can jump in here, Sheikha, I 100% agree with everything that Fredros just said. And I think one of the key words associated with those conversations is proportionality and appropriateness. I think one question that we get asked a lot is, well, how much money should we be asking for for stakeholder engagement and communications. And I think, once again, there is no lump sum that says, if you get this amount of money, then you will succeed. And, or as Fredros is saying, if you engage on day 0 and then day 15 and then day 102 of your project, this is how you'll succeed. I think it's about proportionality and appropriateness, depending, again, on what it is you're trying to do, where you're doing it, why you're doing it, how you're doing it. Those are all key things that have to be the pragmatic foundation of all of your strategies, not just your community engagement strategy, not just your stakeholder engagement strategy. And it's decisions associated with, I think, the definitions of community, stakeholder, public that help you validate those decisions to say, well, where I am as in my research or in my development pathway, it is not appropriate in this moment in time to dedicate a budget line for X public activity. However, in 5 years' time or in the next grant, at that moment is where it could be appropriate. If I just speak to Target Malaria's example, the project has been around for many years, and the engagement pillar has been functional for roughly, we can say, give or take 12 years. So 12 years ago, the community engagement, the stakeholder engagement strategy looked very different from what it looks like now. And it will probably look different 12 years from now. And so I think I just want to re-emphasize Fredros's point, because I think it's so important. A lot of what we're sharing today is based on the lessons we have learned up until this point, but a lot of what we're sharing today could be adapted based on future data, results, but also other, as I said before, external forces that can impact those decisions and how they're made. So sorry for interrupting, but I just wanted to make sure that I made that point in partnership with Fredros.
No, it's great. Thanks a lot, Naima. Completely in agreement. Share in summary, what I was saying is, number one, we don't need a consensus. Number two, we got to have this proportionality. Thanks, Naima, for the terminology. The reasons we do it, like I said in the beginning, number one, you want to gain trust. So social license to operate, gain trust and build that sustainably. Number two, you want to figure out if in these communities you have existing knowledge about the subject matter, existing knowledge about the program you're running. And if you can use that knowledge in a way that helps your project or helps the community or magnifies the impact of the program, the better. And then there's also the issue of getting general acceptance. Now, how do you do that? We can discuss that a little bit later, but I think it's really, really important that you have that proportionality and that you're not necessarily sticking to the academic definitions of these terminologies. Back to you.
Yes, Prosper.
I just wanted to maybe I'm not objecting what Fredros and Naima are saying, but rather I think just make it clear that yes, we do not need a consensus on the definition of what community engagement is, but we need a consensus on the principles of community engagement. And this is, I mean, I can clearly hear all of each one here talking about trusting, transparency. So those are like the fundamental principles of community engagement. We need to have a consensus on those. How do we give back to the communities? How do we engage the communities? Who recruits the communities like volunteers? So those are kind of the principles that we need to have a consensus with. And I think those would also be part of the definition. But the entire definition of it, we don't need to have a consensus on that. Just it. Thanks.
Thank you, Prosper. But now that you're on the spot, on your line of work, what would be an ultimate goal for community engagement? I mean, in your research work?
Wow, okay. I never saw that coming. In my line of work, so early on I said I have keen passion on community-based, community-led surveillance and control of vector-borne diseases. So what am I looking at? One is just to make sure that my objective, number one objective, is making sure that the things that I'm actually doing are relevant to the communities. They may not yield as sexy results as one would have anticipated, but they have big impact in terms of saving the lives at the communities. So what does the community want in rural settings of Africa, for example? What does the Maasai community need? And those are kind of the questions that I wish to address. And this is the number one reason why I do community engagement. Second is empowering communities. So, and I'll cite one example here of a program that we did in Fiji, here, Southeast Tanzania, where we're using health facility data to identify communities that are highly burdened with the parastemia. And we're using then the community volunteers to go and test and treat the rest of other community members. That means what we are doing is not that we could have trained professionals, but we opted for training the community volunteers so that we empower them to take actions of the challenges that are actually facing their own communities. And that is something, if we want to build sustainable programs, that is for me a way to go. And number three is cost. Everyone, when you talk of research, it's very demanding. Now, one way of ensuring that it's cost sharing, the amount of money I pay people at the communities is not the same money I would pay a research officer to do the same kind of work at the community level. So one is, and the unemployment rate is very high in our countries, okay? So if I train a Form 4 leaver or Standard 7 leaver to do and deliver the same work at the communities, for me, it serves much better than not doing it. But also, again, an aspect of sustainability. You're making the results last longer at the community because you have empowered them, you have given them the skills and the knowledge to tackle the challenges that they will be facing them. But I think the most important aspect is involving them in shaping and managing the challenges that actually are pertinent to their own communities. Over. I'll stop here.
Thank you so much, Prosper. Noni, and I would like to hear from you.
Thank you. I was in the middle of typing an answer, so let me just leave that first. So I think a lot has already been said. Maybe I'll just speak from our own experience here in Kenya. Initially, our engagement goal for our communities here in Kilifi was to promote, what can I say? It was to promote information sharing. So we had, sort of like three goals. One was creating relationships, developing meaningful relationships, having our research conducted in an ethical way, and then promoting sustainability of our research center. I'll start with the bottom one, sustainability. Sustainability came in because at the time when we were establishing our engagement activities, there were a lot of rumors going around in the community about the work that we were doing and some of the research procedures that were being undertaken amongst the population in terms of study volunteers. So those rumors would actually have threatened our existence as a research center. Community members were saying, they don't know what we do. We seem to be sort of like devil worshippers, and obviously that raised concerns in terms of what then can happen to staff if people feel that they are devil worshippers. And then we wanted to create relationships. Again, community members said, they don't understand us, they don't know us. Our research center is built in such a way that when you're walking on the outside, you can't actually see it. You can't see our buildings. So community members felt like, we leave our premises and go out in our program vehicles, and then we come back and disappear somewhere. People don't know where we go. And so we wanted to just build those meaningful relationships. And then ethical conduct is, again, because we realized that the population couldn't differentiate, for example, between, I've said we carry out research in hospitals, primary healthcare facilities. So our population could not differentiate between medical treatment in terms of diagnosis and a research activity. And so we realized that people could actually be consenting to participate in research because they think they need to be able to get medical care, or they feel like if, or they feel that the research and the medical care are one and the same thing. So we needed to be able to try and differentiate those two. Some of the other goals later on now, some of the other goals that have come up in terms of our engagement include goals where we want to get input into our research processes and procedures in the program. And so conducting consultations with community members to be able to have them inform us how best they feel we need to be carrying out our research activities. Then things as complex as thinking through together with community members around things like data sharing. So, for example, when I joined KEMRI back in 2013, there were no issues of researchers need to share data. And then somewhere along the line, I think around 2015, 2016, matters of data sharing came up. And so we went back to the community, says, you guys are giving us data. Now we are being told that data needs to be put out somewhere and other researchers can access that data. What do you people think? So that's a goal. You can engage to be able to get input from communities into the work that you're doing. And other reasons are to be able to just demonstrate that you respect a population. You're engaging to be able to show that population that you're respectful, you're accountable, you're able to show, this sort of like these are the projects that we've been funded to do, and we've actually done them. These are the things that we said we're going to do, and we've done them, and these have been the results. And I think some of the others, Fredros already talked to in terms of things like trust. You want to build trust. I remember a case that is still very vivid in my mind. I read about it. I think a lot of people may already know about it. The case of some researchers in Ethiopia who suffered mob justice, and two of them lost their lives, and one was very badly injured and has lifelong disabilities because of that incident. And it was a case of a local scientist who felt they come from that village, they come from that area, and they are known, and they've already gotten the appropriate permissions about their study, and they just started. And then a rumor just began, just like that. And people caught them one day in the villages. They were going about their work, and there were mob justice, and two of them lost their life. So that building trust is really, really important, and just building those relationships with the population where you're carrying out your research. Back to you, Sheikha.
Thank you so much, Noni. So as you said, as you shared the story of rumors, it takes one wrong message to have a completely different relationship between the community and the researcher. And it's really bad when the wrong group of people have a control on narrative of what a researcher is about to do, be it being magnetic after having a COVID shot, or Prosper doing lava source management, and maybe the narrative is intending to kill people's livestock, some sort of things. So what is the most innovative ways of engaging the community for effective results? I'm still with you, Noni.
So I think the term context specific is going to come out a lot in our talk today. Innovations vary. You can hear an approach that is being done by, say, I can learn from Naima in terms of some approach that she's using to engage stakeholders in their projects. And then I can pick that up and come and add on, some, I'll very loosely say some spice, just make a few changes and then innovate on that. So some of the things that we've done, for example, for us is borrow from sort of like the development world. I come from a background of health communication, social behavior change communication in my past life in the previous organizations where I used to work. And so picking up some of those and then innovating around them and developing innovation. So innovations can be context specific. We have innovated around, for example, we have had a schools engagement program that was started by Alan Davis. I think he's here on this webinar. And so we've had innovations around that, where, for example, we started off just having face-to-face engagements with students, having our researchers go to the schools, having students come into the research institute, and then we were able to borrow an innovation known as I Am a Scientist, Get Me Out of Here, which is a competition that involves scientists and students. And we have, for the longest time used that as an innovation that enables us to reach even more people. So again, even when you're innovating, what's the reason for your innovation? So for us, we felt we were very constrained in terms of the physical activities. We could only reach a few schools. When we expanded to online engagement, that enabled us to reach even students who are in Nairobi, our capital city, students who are in Mombasa, which is to the south of where to the south of where we are, and that innovation really enabled us to reach more scientists and enable scientists to be able to engage. Other types of innovations that we have used include, using virtual reality. Again, as I've said, we normally encourage students to come into our laboratory. We also have something we call an open day where just organized community groups, women groups, youth groups, and those kinds of groups can come into our labs to come and basically see what our scientists do in an aim of continuing to build those relationships. And one of the ways we have innovated is taking films and then using virtual reality, because we realize we can't bring the entire population into our labs. And sometimes, like for example, during COVID, our labs were shut. There was no way you were going to go into the laboratory. And so using those types of innovations, like using virtual reality, is a good innovation to enable you to reach people at a time when maybe people cannot come into the lab. They're able to directly see what researchers are doing in the labs, and researchers are talking to them through virtual reality, and it's a really great thing. So some of the innovations that we've used. Back to you, Sheikha. I hope I've answered the question.
Yes, Noni, thank you so much. I have the same question to Naima.
Hi, sorry. As interesting as our conversation is, the chat is also very interesting. So I'm trying to answer questions while keeping up with the flow. I think the issue of misinformation and disinformation is, again, one that is not unique to the technologies or the research that we're all working on. I think it's something that is currently facing the world at large. And one of the key challenges we face is when we are trying to communicate a very scientifically technical piece of information. The research that takes place in our labs is, I have to admit, I'm not a scientist. It overwhelms me sometimes. And I've been in this project for 4 years. So when thinking about some of the communities that we operate in, that many of them are some of the most disenfranchised rural communities on the continent of Africa. So they're already struggling with literacy levels and understanding even some of these technical terms that we have in English, or even Swahili or French might not exist in some of the traditional languages. So that is in itself a very significant challenge we face in engaging with the communities. And a case study or concrete example I'd like to share with you all today is the work conducted by our in-country communications teams, as well as, and with support from the global team, in co-developing a common glossary. And in this linguistic exercise, we tried to see how could we as a project empower the communities and also our colleagues to be able to communicate on some very scientific terms that might not even exist in these traditional languages. And one of the, I can't share my screen, but this is available online. It's on our website. We have a peer-reviewed publication on it. But just briefly to describe this process, which I think is very innovative and very exciting and can be used for any research project. Step one was to work with our scientific colleagues to understand to list all of the critical scientific terms and concepts that we felt would be needed to be communicated to the stakeholders. So this includes gene or DNA or chromosome or inheritance. So there's this first step of the list of terms that would need to be communicated to the community. The second piece was to brief a linguistics team, and this consisted of Target Malaria as the project, but also public and private linguist experts, as well as the communities themselves. So in the second step, Target Malaria and the public-private linguists worked together to propose what could the meaning of the technical term gene be translated into a traditional language. And the third step was then to identify what could be the potential terms that already exist in this language in order to translate them. And the fourth step was then to have a discussion and testing with the community themselves. So we brought together focus groups with the community and said, we're trying to define the term gene. Would definition A or definition B be more accurate? And the community themselves were able to say, nah, that doesn't make any sense. We don't want that. Or to say, this works, but you can tweak it here. Or to say, this is good to go. And they were also able to say, in our local context or in our specific community, that doesn't make sense, but maybe in a different community that would make sense. And then we were then able to take all those results and put them together into a final glossary that was shared with the community, that was shared with our in-country teams and field entomology colleagues, as well as also the public institutions and the institutional ethics committees that are reviewing our work, to say this is now our joint co-developed glossary that we will use when communicating with this specific community about the key scientific terms in order for them to understand our work. And I know that could sound quite basic, but for us, it's something that we still receive a lot of interest in, because this is a process that was repeated in Uganda and Mali and Burkina Faso. And these, again, are in very specific communities where you can't just replicate the glossary and copy paste. What you can do, though, is replicate the process. And that has worked very well. And as I said, it's all available on our website where you can find a blog and a link to the peer-reviewed publication that explains the process more. Thank you.
Thank you so much, Naima. I didn't realize that we are past 1 hour since we started, and the discussion is just getting heated up. So I'm going to throw this question to Fredros, and I would also like Prosper to respond to the same questions before we hit the question and answers which have been written already. We have numerous of them, around 16. Yes, so it's very easy to mix up or to, I would say, like, it's very easy to mix up between community engagement or engagement in health research and health promotion in public health research. Like, these two content could be easily mixed up. Sometimes a person would be doing a health promotion and they would feel like they're doing community engagement. So how do these two items differ? How do these two concepts differ, and how can they be easily differentiated, especially with researchers who are doing the global health research?
Yes, Sheikha, this is an important question. I think it's actually broadly an important distinction to make. And so it's also a very recent phenomenon, actually, that public health scientists are finding themselves having to do much more than they should, or much less than they should. If I am a scientist and I'm working with communities, there is a lot of pressure now, either from funding partners or from other stakeholders that say you've got to work with the communities and make sure that whatever your findings are, that those findings are adopted. And I was saying earlier that that is probably not the right way to do it, because then that goes into the realm of health promotion. So the distinction I draw here is that once a study is completed and those results go into policy and those policy statements are made, and that's usually a responsibility of a different arm of government, and it could also be supported with guidelines such as WHO guidelines, for example. And then we all have a responsibility to promote that as best practice. And that is a very different thing than engaging people for purposes of getting social license to operate as a scientist, or engaging people to try and find, Fredros just came to say it, or going into the communities to seek local knowledge. So on one hand, we could do this for purposes of our own research. On the other hand, we do it for things that are already proven, for which you really just have to promote that best practice as clearly stated. And I think one of them is clearly a role of scientists. Another one is a role played by different people. So you go to the National Malaria Control Program, you find, for example, they have SBCC, Social Behavior Change Communication, as an aspect of their strategy. And within that, they do a lot of health promotion. They also do a lot of active engagement. If you come to a research setting, you find a different kind of program where we are the reason for our engagement is slightly different. So I don't know if that clarifies it. Now, before I hand this mic to Prosper, I think what is also very important is that we are always aiming to improve outcomes for both the research community and the communities. That the outcomes we are aiming, that the activities that we are implementing are serving not just the researchers, but also the communities. And I give you an example here. I'll give you an example here. If you, let's say you're doing a work of administration, and you design this study that say, okay, I'm going to give kids one tablet every month or every week and so on. And you say, I'm going to use the school system as a delivery platform. And you arrive into the school and you figure out, oh man, there's even no water here for kids to take medicine. So at that point, you immediately fail it. Because you have a very good technology, you have the medicines, you have the protocols, but you've arrived now and there's no water to drink the medicine with. Okay, so you have this challenge of, okay, should we tell kids to bring their own water from the village, or should we dig a well in the school, or should we bring some clean water? And this completely different challenge, because if you tell people to bring their own water, the kids turn up with different kinds of bottles, different kinds of water, and it introduces a different message. So you have to collaborate with people from the word go to figure out all these auxiliaries around that specific program. It improves the outcome of your research. In other words, you get much cleaner data, but at the same time, it improves the outcomes for the communities in the sense that you're not introducing a new challenge during that program. During that program. And lastly, it matters who the messenger is. And for some of the work that we do, it's very sensitive, right? So scientists might think, oh, this is just community engagement. I'm sure I can do it. And at Ifakara, I work with a fantastic colleague called Lena Finda. And, you know, she's always insisting that you've got to very clearly clarify the messages that you want to give the people, but also that you send the right people there. So if it's just some other guy who turns up and tells the communities, I think you should take this medicine, it's very different than if a community member or a person from that same village is doing that messaging. If it's a sensitive topic, you say, I need you guys to take this vaccine. You know, if it's someone who is already associated with either certain political alignments or associated with certain bad technology or certain historical events, even if they're nice people, they're probably not the right messengers for that. So it's always really nice to select the right person to be in the front line so that we can just follow them. I would like to stop there for now, and I'm sure my colleagues have a lot to add to the subject.
Well, I think, Fredros, you've said it all. Just to highlight that the way I look at the two, community engagement and social marketing, is one is a vehicle for enhancing the delivery of the other or the achievement of the other. While so community engagement for me, it's a more a comprehensive sort of objective. But when you have done your research, you've properly engaged the communities on the principles, relying on the principles of community engagement, and you've gotten good results. Now you want to scale up. Now you want to improve service delivery. So the role of widening the scope of community engagement, this is left to another group, to a separate group. It's not the role of a researcher to do health promotion, as Fredros has said. I think the role of a researcher should end with engagement, that through the processes to the end product. If you have a product, then it is the role of someone else, communications, the various sections, like I know ministries, a lot of ministries have health promotion units. So those are the ones specialized on health promotion. And what you do is, with health promotion, is you take the end product from a research and then you promote it through. You want to improve now the uptake. But it's not very far in terms of the end point, because they're all driven by the same objective. You want to make sure that the communities are fully aware of what is going on, the benefits, and if there are any setbacks from the program. So I would say health promotion is really the second step from when the research is almost done, toward the end. Now you want to promote it for widening the utilization of the research findings. This is what I would say, but it's being done for the same purpose, the same objective, but different groups of people that will be doing it. A researcher plus someone else who will be doing the health promotion. Over to you, Sheikha.
Thank you. Thank you so much, Prosper and Fredros. Looking at my watch, the time is not on our side, so I will request the panelists for additional 10 minutes so that we could respond to some questions before we finish our webinar for today. And probably we should think of doing 2 hours next time. Okay, I have a question here for Noni. The question reads, how could you develop trusted research and make the research collaboration sustainable beyond the funding?
Thank you, Sheikha. I think a very quick answer is, developing trust means you need to be honest, open. We are an open research organization here in Kilifi. We allow community members to speak their minds without trying to muzzle them. We take up their recommendations, and those recommendations that we cannot take up, we tell them why we cannot take up the recommendations. I think if you are in a research institute, it's important to just be open and allow community members to come and see what it is that you're doing. If you're in a research project, talk to community members as regularly as possible about your research work, respond to their concerns, give them feedback at appropriate times or in a timely manner, where they feel very concerned, something has happened, respond to that immediately. You will be able to build trust, but trust can also be broken. So yeah, back to you, Sheikha.
Thank you so much, Noni. I like that trust can also be broken and it takes just a matter of seconds. Naima, over to you.
Sorry, Noni, Sheikha, I just saw a question in the chat that I think would be better answered verbally rather than in writing. It's a question by Austin Okinyo, which says, research is a multidisciplinary and collaborative entity. While engaging the community, how do you manage or go about community norms based on different cultures and their priority needs, which might not be in line with your research objectives? All of the questions were very fascinating, but I wanted to make sure that I answered this one, at least from the target malaria perspective. And of course, as always, I open it to my fellow panelists to add. I think it's important, kind of similar to what Prosper was saying, it depends on who. And I think we as a research project need to be able to be open and honest about what is within our mandate and what is not. So one question we have received over the years has been, when we go into the community and we work with a community that agrees that they would like to establish a community representative body that can decide on their behalf. So they would have representatives present, either, from whatever selection of their community that they choose, and say, this is the group of X number of people that we trust to engage with you on our behalf and sign any agreement with you on our behalf. Great. Now, some of the questions we've gotten in the past is, what do you do if this group is all male? And the village has said that all of our representatives are male. However, we as a research project are always talking about, we want to encourage gender equality and make sure that women, especially women scientists, especially African women scientists, are at the helm and being promoted of their work. How can we, on one hand, be saying that we're all about gender inclusivity and equality, but then on the other hand, we have a community representative group that is all male? Is that a contradiction? And I think on one hand, we also have to just be open and honest about what is within our scope and what is not. And we also have to be open and honest about the respect we give these communities for the choices they make. Now, in this situation, my colleagues and part of our stakeholder engagement strategy is to respect the decision of the community to say this is their representative group. However, in addition to that, we request permission from the community to allow us to still engage with the women in the community peripherally or in parallel to this consultative group, to make sure that we as a project are still giving the women an opportunity to be heard, and that their views, whether in private or otherwise, are still integrated into our approach. However, the final decision is still given to the representative group. So on one hand, that has been our strategy to reconciling one example of a disconnected value system, we can say, respecting the community while still ensuring that we give the women or any other peripheral group the opportunity to be heard.
Thank you so much, Naima. And I have one question this is for Fredros. What is the difference between general acceptance and consensus? Isn't there some level of consensus that would be needed?
I don't know. Noni, Prosper, Naima, do you guys know? What's the difference between acceptance and consensus? I could try, I don't know, but there's a risk that I say something completely wrong here. I think consensus means people are in agreement. And that the final word is endorsed by all the parties. And that leads to acceptance. Now, having said that, I've got to say, on one hand, I'm a scientist and academic, but on the other hand, I also come from these villages. So I think sometimes, trying to, define these terminologies is an academic way you're wasting time. We know what it means. So do the community accept what you're doing? Broadly, you can't get individual consent from every individual, but broadly speaking, you want to study the wind in the community and do what people do. And sometimes things change. So I think someone mentioned earlier that we need a level of responsiveness so that if there are changes that you can respond to that directly and make adjustments either to your protocol or to the approach that you're using. And Naima just described here a fantastic example of, you go in, the community say, these are our representative leaders. And so if these people say yes, then you can say the community has accepted. But deep down, well, the people who have accepted are really just, the male leaders of the community. And from our research perspective, you also want to hear from the mothers and the children. And so you can put an additional request there and get a second layer of consensus or a second layer of acceptance, if you like. The last point I want to make here is at some point, Sheikha, we were discussing different approaches to community engagement. I think this matters here as well, because the approach that you use can target different subgroups in these communities. And you go to some of these people, you have some who are literate and some who are semi-literate or not. And so the approach has to be different for those. For some people, you want a baraza, a public baraza to have a conversation. For some people, you might use a dance meeting or a theater session or digital media platforms. And for other people, you just want to use the radio, for example. So you might structure these methods differently to try and get this engagement as broadly as possible. Thank you. I'm not sure I answered, so let's ask Noni and Naima to see, is there a difference between consensus and acceptance?
I think it's what you've said. People, if I can just use a classic example, people could either be in acceptance of something or perhaps they're not accepting something, but you want to hear from many others. So build sort of like an understanding of, is everybody in agreement? Is everybody accepting this project or not accepting this idea? So it's in our country here, we say English came by ship. So, so it's a way of just trying to find out. A consensus is a way of finding out how many people agree with this thing or don't agree with this thing. I think for me that's in simple terms. So it's what you've said, Fredros.
But Sheikha, just very quickly, I remember that once in the United States, a company called Oxitec wanted to release mosquitoes, and they couldn't find a better way to do it than just do a vote. You know, just ask people. So the government decided that people will vote, do some kind of a referendum, and if the vote says, you know, pro the technology, then you go ahead and release. And in fact, even in Kenya and Tanzania today, the regulatory agencies still do public engagement processes that involve some kind of a vote. Yeah, so
We are in trouble
maybe that
right now
vote
because of
is
votes.
yeah, because of votes. Yes, the votes
People
can
voting yes
convey
and no.
consensus.
I don't
All
know if
right.
Naima wants to add.
My last question to Prosper, and then I will drop my email on the chat box to everyone. And if you have any question which you want to follow up with the panelists, just write to me and I will channel your question to the panelists and I will be sure to get back to you once they respond. So the last question, Prosper, this is for you. As a stakeholder OPI, how do you evaluate the success of the engagement of the community relatively to the objectives of your project? Would you reshape them or adjust along the course of the project? It would be difficult if you have submitted the project as such to IRB. The question is from Stephanie Rambo Arena.
How do I evaluate my what?
How do you know you're successful?
Success
If people don't throw stones at you.
Yeah, so I guess the simply put is when you, as Fredros said, if you build a network, if you are able to collaborate with the community and them contributing positively to your work, that is number one indicator of success. But going deeper, I think when you're designing your community engagement approach, there are definitely things to consider. And for me, I always think of what are the key roles and responsibilities of each. In fact, when I do community engagement work, it starts from the recruitment process. Who do I engage at the community level to recruit the volunteers, for instance? And what are the criteria of the volunteers that I, as a researcher, need? And what will these appeal with the local leaders? So those are the things that are very key. Once you are able to engage the local leaders in the recruitment process and them shaping the thinking around volunteering versus employment, because well, we talk here about community engagement and we talk about volunteering. In actual essence, it's at times it's like we put money at the front and enticing them. It's actually an employment. But the most important aspect is how do you make sure that you are engaging the right people? How do you make sure that you have the right roles and responsibilities distributed across the different cadres of the communities, and each of them plays their role? Because if there is a breakdown, Noni and Naima have talked about the issues of the imbalances. And this is where you start facing the trouble. Because as soon as you've messed up with the recruitment process or the oversight roles, you've given them to individuals with different motives, my friend, I think you are in trouble. So I think for me, it's when I see each cadre playing the different roles and responsibilities as clearly planned and delivering them to the success of the program, then this is for me is a tick box that the community engagement strategy has worked in line with how we anticipated. Shorter than that, I think it's very difficult. And I've touched about the motives. I think the understanding for anyone planning to do community engagement, you really need to understand the motives. So the motive of the volunteers or the motive of the managers, the supervisors that you are engaging. It's very important that you really need to understand. Otherwise, you may be getting weeds in your program and nothing will actually work. I'll stop here. I hope that helps.
Thank you so much, Prosper. Thank you so much, everyone, for joining us today. Here we have our poll results for the startup quiz, which we had. So we had the question which asked, at what stage did the community engagement and involvement needs to be initiated? And we have 67% saying should be at the conception or before starting implementation. And we have 28% saying that it could be initiated at any stage of the research. I don't know what you guys think from this discussion, but what I take home here is I'm going to side with the 67%. Let's see the poll for the question number 2. It was a free writing, and I'll be happy to share the results later on. Thank you so much for sharing, Louis. And I would also like to welcome you all to join our Mesh Community Engagement Network. Just scan the barcode and it will take you directly to the registration page. Also, I would like to welcome you to do the online course as an introduction and practical guide to community engagement and involvement in global health research. This course is free and it has several modules which can be undertaken in any order at any time. It doesn't have a limitation, and the certificate will be awarded after the completion of each module. So kindly scan the barcode, or if you have any question regarding the course, or if you need any clarification, don't hesitate to write to me. I dropped my email on the chat box to everyone. So again, thank you so much for joining us for today's webinar. I would like to extend my thanks to the speakers for your time, for this insightful discussion. It was really eye-opening and it has widened our understanding on the whole concept of community engagement in global health research. Till next time, I thank you, Louis, for having everything laid out for us, and Al for the guidance. Thank you very much, guys, and see you next time.